I think I'll just give a nice little brief introduction. I'm Dr. Matthew Heisey, and we're here today with Dr. Grove Higgins and his team, and we're in the kind of South Denver Metro as well as Monument. So we just got a little bit of the poll results. So it looks like about 50-50. Some folks have been here on the webinar, and we have about 50% new folks. Looks like we also have about 15% of the patients are new to both Dr. Higgins and ourselves. Okay, so I appreciate that. So again, I'm Dr. Matthew Heisey. We're gonna talk today with Dr. Higgins and myself on spine pain. So that would be the neck or cervical spine, the middle back thoracic spine, and then the lower back lumbar spine, which does include the pelvis, SI joints, etc. So we just want to thank everybody for coming on board today. During this shelter in place and interesting times for this pandemic. So we're just going to briefly kind of introduce ourselves individually. This will be kind of our outline of the next 50 minutes. We're going to talk about a little bit about the procedures and or the care, the manual therapy that we offer. If you are in pain, if you are having symptoms, we don't want to ignore those. So we want to be available to our patients so you guys can contact us to see if we can help. We have some good news on the COVID-19 update, specifically in Colorado. We're getting back to normal, closer to normal next week. Then we'll kind of dive in a little bit about what we do at Centennial Schultz Clinic and Regenix, specifically for the spine. We talk about a little bit of the self-assessment examinations for you at home, the range of motion. We're going to talk a little bit about our success story of one of our patients that Dr. Higgins and I both treat, and she's here with us live. That's Miss Teresa. And then on the back half, Dr. Higgins and his team are going to go through a lot of our exercises at home, pain reduction strategies at home. We're going to talk a little bit about kind of who to call and what to do if we're having mild symptoms or moderate severe symptoms. We'll have our information up, and Dr. Higgins and I want to make sure that everybody has at least 10 minutes that you can spend with us over Zoom, video, and or phone call as a courtesy consultation for having a nice lunch break with us today, both for established patients and our new patients. So I'm Dr. Matthew Heisey, and I'm a physician, board certified, fellowship trained. I practice all aspects of orthopedics, spine, pain medicine, sports medicine, and classic physical medicine rehabilitation. I'm also a DO, so I do the osteopathic manual medicine. Our group has published a lot of data on our protocols in peer-reviewed journals for the platelets in the bone marrow. I love the Colorado lifestyle. Much to my own cause of injury. So lots of activities depending on the season. And then my two little cute kiddos at home. We have two offices, Centennial Schultz Clinic North Broomfield office, and that's where a research lab is as well. Then I am running the Lone Tree office full time. That's in the South Denver Metro. So that's just kind of a little bit about me. I have about 8 physician partners in our 2 offices, so we're available, all of us, to help folks both in office and online via telehealth. So we'll just take that to Dr. Grove Higgins right now and his team.
Sure. So my name is Dr. Grove Higgins. We originated down in Colorado Springs, but we've been enjoying working with people from the Denver area and Dr. Heisey as well. That we moved our clinic here not too long ago up to Monument, so we're 20 minutes closer to anybody from the north. Our clinic is the neuroathlete clinic, but it doesn't mean that you have to be an athlete. We believe everybody is an athlete, and we take advantage of the fact that people can learn motion to help people get out of pain and reach new levels of personal performance and in their lifestyle from young to very, very old, including some wonderful athletes. But like Dr. Heisey, Colorado is my home. It's where my family and I recreate and live, and we're outdoors as often as we can. I work with a group of really great individuals, exercise therapists, massage therapists, and psychologists and neuropsychologists in order to provide the full spectrum of pain relief and tools that can help people that have been in pain and want to get not just out of pain, but have a different lifestyle afterwards.
Now, again, we don't want to ignore pain. We don't want to ignore the symptoms of spine pain, numbness, tingling, and weakness. So, you know, both myself and Dr. Heisey, Dr. Higgins, all my partners, we're all here for our patients. So right now, telemedicine for kind of mild symptoms, that's going to be new patients and follow-ups, cell phone, tablet, computer, comfort of your own home. So that's going to be available to kind of do initial screening of symptoms, follow up, how to do home exercises if you're in pain, etc. The other thing is, as physicians, we still have in-office appointments, procedures potentially available. We're able to do that in a very safe environment. So we have my contact in the Centennial Schultz Clinic, or CSC, kind of here in the middle, and Dr. Higgins in his Monument, Colorado, neuroathlete number here as well. Also, the email list that we sent you to join this webinar, that also is another way that you can get in touch with us. So basically, the telehealth or telemedicine is that we're able to communicate on the phone or Zoom video conferencing, just like we're doing today. And if it's a new patient, we're able to do the questionnaire, self-exam videos, move the neck, move the back, touch each finger for sensation. And that kind of helps us understand what part of the neck is bothering the hands, perhaps. We can do that throughout the entire country, all 50 states. And I think that gives us a really good kind of patient and physician relationship to set up our in-office eval, since some patients are a little nervous or concerned about coming into the office. But we want to reassure everybody that is an option. You can still be seen in office if you need to. So if there is a surgery canceled or a spine epidural canceled for sciatica, and we're not going to the hospital or surgery centers, that's kind of the perfect time to speak with one of the Centennial Schultz physicians and or Dr. Grove Higgins' team. We're going to talk today too with the patient we have in common, and that's kind of that common bond where we can help patients before procedures. I can do the procedure, then we can do the rehab after the procedure. So when we use blood platelets for the spine or orthopedic joints, tendons, ligaments, the disc, the facet joints, all those things, that's kind of termed interventional orthopedics. We also have the capability to do pain management procedures in the spine, but we found that we get longer term results and healthier results without the side effects of invasive surgery or fusions or disc replacements in the neck or steroid shots or what's called burning of nerves or radio frequency ablation or burning. So that's kind of how we approach it in our office. Typically, the spine, we're going to use blood-derived platelet-rich plasma. So when we kind of look at the pain generators, there's always going to be the stability of the spine or the joint, the cushion of the discs or the cartilage in the spine joints themselves, called facet joints. The nerves then control the muscles or are responsible for sciatica, muscle cramps, weakness, numbness and tingling in the hands, arm, feet, etc. Symmetry left to right, I see a predominant sort of left disc bulge. It's not always in the center, irritating both nerves. So when we kind of use this approach in both of our offices, we're able to figure out the whys behind your pain. So we don't want to ignore the pain. We want to make sure that we're able to stay on top of the pain and be proactive. And this is, again, some resources that we can use while we're at home. So this is an example of two things here. On the left side is going to be an MRI from the side view of the low back. This would be the tailbone, lumbar 5S1 disc. And we can see here that we're kind of slipped here at the lumbar 4 bone is slipped right in front of the MRI. Sometimes when we use the X-ray, we can see that it moves a little bit more. And kind of the point of this slide is to follow up on those last 4 pillars on the last slide. There's a lot of different structures that can cause pain in the spine. We want to evaluate them together. It could be the discs, okay? It could be these black nerves that are being pinched as they traverse the spine. The facet joints are in the back of the spine. This thickened ligament is also contributing to pinching the nerves in the middle of the spine. We can see on the X-ray clearly that there's thickening of white bone of the facet joint arthritis here. Then there's weak bone here, and that's what's allowing the 4th bone to slip forward. So we like to look at the entire functional unit of the spine. We don't like to ignore spine pain. We don't like to ignore numbness or sciatica or weakness. That typically means we're getting nerve irritation, and we want to make sure we address that so things don't get worse. We don't want the pain to get worse where at that point we're failing all chiropractic, physical therapy, conservative measures, failing injections, and the last resort is surgery. We absolutely never want to ignore spine pain, and go straight from 0 to 100, meaning spine pain to surgery. This is just a quick little example. And then just again to reassure our patients, so what we're able to do in office is called a maximum protection zone. So everybody is wearing the personal protective masks and gloves. We've been able to procure the finger stick antibody test for the COVID-19 virus. So we're able to test all of our doctors and staff members and patients that come in for procedures. So that's just kind of reassurance that, again, we're nice and safe in the office. The best news, I think, for everybody in Colorado this week is Governor Polis said we're not going to extend the order that is up on April 27th. So April 27th, elective procedures, in office with your physical therapist, in office with Dr. Higgins, the chiropractic adjustments, that should be coming back on board. And we want to make sure that everybody understands that this is going to be a safe option to come into the provider's clinic. It's very, very safe compared to maybe the grocery store. A lot of folks are there. I'm not seeing everybody outside in the community wearing gloves and masks. However, you will definitely see that in the physician office. So generally speaking, right, if you do have symptoms and you're at high risk and you're having fevers or cough, it's still best to stay at home. And that's when the telehealth option comes into play. If you don't have symptoms and you're not high risk, you don't have cancer, you're not diabetic, you're not taking medication that might lower your immune system, we absolutely want to make sure that our patients know you can come into office to see us. Specifically in Colorado, we have the links here. This is the update almost daily, different resources for the symptom tracker or where we are with the virus in Colorado. And then, of course, CDC. The CDC updates everything. I want to make sure all of our patients understand that they can look at that and they get a good review, a good overview from the CDC on where the states are individually, but also where we are total as a U.S. All right, telemedicine links. So these are examples. We send video links per the area. So for instance, today, if we talk about neck pain, cervical spine pain, you know, the self-assessment exam is going to go over your neck range of motion. Where is the pain located? What about the side muscles of the neck, the front, the back, the traps, headaches? Do you have sensation problems or weakness down the arms? And that's going to give us the idea of what spot is the culprit. Is it your cervical 2-3 disc, or is it the lowest one at cervical 7? So that's kind of what we can do so that patients can understand their problems just a little bit better at home, okay? We're going to be doing this weekly seminar, so we're going to focus on kind of the upper extremity moving forward, the end of April, and then the 1st of May for the elbow and wrist pain. Also, some of my partners are doing other things. So on Thursday, Dr. Markle is going to be doing another webinar to work with different posture and spine positioning ergonomics with Renee Sherry, one of our therapists. Dr. Fossil is also doing a Facebook Live this Friday. If anybody does have questions, we are both available by email, myself and Dr. Higgins. These are the numbers to the office as well as our websites and locations. So we'll be here to answer some questions as we go through. And I'll kind of stop there and pause, and we'll let Dr. Higgins and his team kind of take over some more of that, and then also share one of our patient stories for everybody at home.
Yeah, just to add a layer on top of what Dr. Heise just said, that image of the X-ray that he had, the MRI and the X-ray that he had up there, it's a really good example of how this is a cumulative thing. Most of the time, those are not from instant trauma. Those have developed, those changes that you see there have developed over time. And so there were a lot of signs and symptoms and things that possibly could have been giving you pain, but didn't, to just cause tightness and discomfort while you were, exactly, thank you very much, while you were developing the symptom of pain well before that. And I think Teresa can talk to that a little bit because before you have pain, a lot of times you have a lot of other symptoms. And this is something that as a manual therapist, I'm not going to be able to fix. I can help to manage the symptoms and some of the outcome. If we get to it early enough, we can help with the alignment, and then with the exercise therapy that our exercise therapist, Pat, here can talk to as well. You can do a lot to start fixing those problems and maybe even stave off the necessity of seeing somebody like Dr. Heisey. But when you get to this point, you need the tools that in regenerative medicine, I think, really change the game as it goes to orthopedics. And we're really glad that we have. So I'd like to introduce Teresa. Teresa is she was well ahead of the curve in the sense that she's been an office worker from home for how long?
10 years.
10 years. She's been working from home for 10 years, and now we're all off. Now we're all home. And she's one of those individuals that wanted to be healthy, and so she set up as healthy as she could environments at home to help herself stay healthy and to stay productive and such. But along the course of the last 10 years, she's developed some problems, and that's unfortunately or fortunately, the way, depending on how you look at it, how we got to meet you. So Teresa, thanks a lot for coming and spending time with us today.
Absolutely.
Yeah. So could you give us just a little bit, can you give us just a little bit of a history of what was going on with you before you and I ever got a chance to meet and we started on this journey together?
Yeah, absolutely. Happy to. And thanks so much to Dr. Heisey and to Dr. Higgins for asking me to join you all here today and just share my story. So I am a healthcare consultant, and I've been working from home for about 10 years or so now. And as Dr. Higgins mentioned, I do have the opportunity to put myself in a setup that is going to allow me to remain the healthiest possible working from home. When I started and I was sitting at my desk in a chair, I did that for a short time and said, yeah, no, this is not going to work for me. Smoking, sitting is the new smoking, right? So I went out and did some research, and I ended up with buying a treadmill desk, which you can actually see behind me here in my office where I'm at right now. And it was really great because it allowed me to walk a ton of miles every day and stay really active during the day. So what I didn't know is that tool to help me be more healthy was actually causing trauma to my body. And actually it was probably cumulative trauma from years of working at my desk and reaching for my keyboard and causing my shoulders to be rounded forward that ended up causing the issues that I ended up having with my neck and my shoulder. So last year in July, I started to have a lot of pain in my left shoulder. And I initially just thought it was tightness in my shoulder and muscle spasms in my shoulder. And actually I'd kind of had those off and on for years while I'd been working at home. But in August, the pain started to go down my arm and that became so severe that it really started to affect my lifestyle. And like Dr. Heisey and Dr. Higgins, I'm very much a Colorado girl and enjoy everything that it has to offer. And I found that I no longer could golf and run the trails and ride on my bike and do all those things that I really wanted to do. And sitting in the car was probably one of the most painful things. I was really, really miserable. But I'm very much a take control of my life kind of person, which I'm sure you can tell by that introduction. And I know that our bodies are meant to be healthy, and I know that they want to heal themselves, but I also knew that it was up to me to figure out how to do that. And initially I thought this was just muscle tightness. So I tried going to my massage therapist. I had weekly sessions with my massage therapist, and it provided some very temporary relief. So in August of last year, I went to see a chiropractor that I had actually seen in the past who does active release therapy. Really great chiropractor, but you know, the active release therapy wasn't really helping me at all. It was, you know, him just kind of manipulating when I went in to see him. So finally, in August, when I started having pain going down my arm, he decided that we needed to order an MRI of my neck. And I have to tell you, what we found really surprised me. I said, sure, I'll do an MRI, but you're not going to find anything. I've got this tight muscle going on in the back of my arm from working at my desk so much. And but no, the fact was that I actually had things going on within my neck. I had some disc protrusions, I had some stenosis, I had a nerve impingement, and all of that was then causing this wonderful muscle spasms in the back of my kind of scapula area, and that nerve pain that was going down my left arm. So I had no history of trauma. I just had this wonderful history of working really, really hard and at my desk for long hours, walking 10 to 15 miles a day. I thought I was doing a lot of good for myself, and I was in some ways, but not so much in others. Would you like me, Dr. Higgins, to share with them just some of the things that I tried before I kind of ended up with you?
I think that would be a great idea because many of them have done the same.
Okay, awesome. So that was August when I had my MRI, and over the course of the next 3 months or so, I have to tell you, I think I literally tried everything that I could have, which included PT. I have a TENS unit here. I have a foam roller. I did an inversion table. I went and had acupuncture. I stretched. I did put heat on it. I had trigger point injections, and I even had one cortisone injection in my neck. And I have to tell you, all those things that I did, none of them brought anything other than very, very temporary relief. So the chiropractor that ordered my MRI, you know, the first thing he did when he shared my report with me is give me an order to go see a neurosurgeon. And you know, I knew that surgery on my body, taking something out, you know, changing something that you just can't put back was definitely something I would consider, but it would absolutely be the last resort. So I did end up seeing a neurosurgeon who did recommend a nice course of surgery that I could have with my neck, but I really did not want to go that direction. And I was very, very blessed that one of my neighbors actually knew Dr. Higgins. And they said, you know, before you go see a neurosurgeon, you know, we know this guy and he's a chiropractor as well. And he said, who's great. And he had done wonderful things for his wife, and she was quite debilitated, and he was really helped her to get better and take, you know, control over her life again, essentially. So in December, I got connected with Dr. Higgins and with his trainer, his therapist, Pat Marquez, and they're absolutely amazing. And I really believe that step, making that appointment with Dr. Higgins, was that step that got me finally, after months of pain, going in the right direction. And Dr. Higgins was not all about, well, come on in and let me do all these things to you so I can fix you, but it was rather about, let's figure out what's going on. And they really, really listened to me to try and understand, first of all, what's causing your injury. So we know what the MRI says, but really what's happening behind this, what's really causing what's going on, and really working with me to get a plan in place to help to start reducing the pain. And it was things for me to do. Certainly it was about helping me how to take control of my life again, and giving me exercises and movements and doing things that, you know, I never really thought would make that big of a difference, but made a tremendous amount of difference. And then Dr. Higgins is who connected me to Dr. Heisey as well, because certainly looking at my MRI, there were things that we can't, you know, just adjust. There were things that I couldn't just fix on my own. So I did a ton of research on the Centeno Schultz Clinic and stem cell therapy for orthopedic procedures. My healthcare background is in oncology, so I know a lot about stem cells and oncology, but I'd never heard of stem cells in orthopedics. So I was online again, and I have to tell you, I completely devoured their website. I read every ebook front to back. A science background. I have to have evidence-based. I need to see the studies. I really need to know that this is something worth putting my time and effort and money into, because I wanted to get on the right path as soon as possible. So that's how I got to Dr. Heisey then. And I went in and had an assessment with Dr. Heisey. I don't know that I've ever had an appointment with a physician where they spent 75 minutes with me, but he did, doing a really complete, thorough assessment, going over all of my images, really talking through what this looks like, has happened to me physiologically, and then talking about, here's what some options are for you. And again, it's about your body healing itself. And I loved that, because I really didn't want some chemicals. I didn't want foreign bodies in my body if I didn't have to do that. And then I continued to go to Neuroathlete and to go to Dr. Higgins and Pat, because the thing I really knew that I needed to do through my research was I need to get my body in the best place possible before my platelet-rich plasma procedure, because I wanted to make sure that it was going to be as absolutely effective as possible. Again, doing my research, I learned about, how do I build my own stem cell, production, my growth factor production? How do I go into this having the best, healthiest, most mitochondria in the whole world? So I did a lot of things, and I continue to do those things now, which include intermittent fasting and, making sure I eat a really, really good diet, so that I can do all those things, get those inflammatories out of my diet, because I know that even though injuries sometimes happen from external trauma, I believe that all healing begins and disease begins and ends with our gut. So getting that best diet in me possible. And I continue to do infrared sauna and high intensity training, interval training for my workouts, which is great, because who doesn't love a 20-minute workout? And also, Pat taught me about blood flow restriction training, strength training, as a great way to boost stem cell production. And I continue to do those as well. So sorry, Dr. Hughes, that might have been more than what you're asking for, but that's my story. And I had my procedure on February the 7th. I continue to rehab myself at home, especially since we were shut in. And I would have to say that I believe I'm at 70% improvement from where I was just 2.5 months ago. So that's
fantastic.
Pretty significant improvement.
Can I share your MRI?
Oh, sure.
Okay, and then I do have some actual pictures of the procedure. All right, so thank you so much, Teresa. If everybody could see my screen, this is her neck, and the black is the spinal cord and the white spinal fluid. This was the biggest, baddest disc bulge right here. So if I scroll through it, you can see right there, that black line significantly is protruding into the majority of the canal. Then on this cross-section view, the whole nerve was pinched and fluid was building up there. So the surgeon wanted to cut through the front of the neck and take out this whole disc, and then you either have to do a disc replacement or a fusion thereafter. So instead, this is what it looks like when we use the x-ray and the needle injections. So we ended up treating the bad disc bulge, the 5-6 and the 4-5. Kind of as I go through it, you can see the contrast filling in the spaces, and that's showing us that we are in that spot, and that's all platelet based. So that's platelet rich plasma to help improve blood flow, decrease pain without the risk of surgery. So that was just my little 2 cents on her specific diagnosis, and we really appreciate that you trusted us to help you and avoided surgery, but also you did not ignore your pain. We don't want to ignore the symptoms that move forward, and now when they progress from the arm, from the neck to the arm, that's definitely the red flag to call a provider and say, hey, I'm starting to get pain from the spine actually going into my arms or legs. So that's just kind of her specific story. Thank you so much, Teresa.
Absolutely.
Yeah, and the best part of this is that she's continued to do it again, even without being present, without being in the clinic with somebody to hold her hand to do the therapies. So even before the shutdown, she was doing majority of her own work and taking the material that Dr. Heisey was able to put in the right place so that way it could heal and continue to progress that. And the type of problem that you have, Teresa, is one that develops over years. Like you said, there was no trauma or anything like that. And the process of healing is somewhat similar. But the beautiful part is that when you know what to do, when you know the right thing to do, which is actually quite easy to do, you get the result. And if you're willing to push the buttons, as it were, and do those right things continuously, you will get change, and change in a much faster time, thankfully, than what it took you to get to this point. So I really commend you, and like I told you on a text, it makes it very gratifying to work with patients who want to get better, aren't looking for just the pill, and are willing to go the distance and do the small repetitive things that are asked of them that will make the biggest difference. So if you had one thing to tell the people who are listening, and then I know you've got to get to a meeting. Yeah.
I'm good till the top of the hour.
Okay, excellent. But if you had to tell people, one thing, that to encourage them to be proactive and be engaged in trying to solve their problem, pain or otherwise, what would that be?
I think it's really just what you said, Dr. Higgins, is that, we can take control of our health and move ourselves down that road a whole lot faster. Our bodies want to heal. And so just making that commitment, do I like my life the way it is right now, or do I like it the way that I envision it to be once I'm healed? And then what can I do, even the little single things every single day? Those mobility and strengthening exercises that Pat gave me and that I work through every single day, it takes me no more than 10 minutes to do those. And I stack those with other workouts that I want to do. But, 10 minutes is very little time to, start to make those incremental improvements that are going to make a really big deal over time, versus having someone just, give you a pill or shoot you a prescription that, if you don't do it, it's not going to happen. So it's how much do you want change?
Yeah. So what we'll do is we'll show some of the drills that Teresa is actually doing for the neck. If I know most of the people that are listening, and this is pretty common for each of the webinars, have low back pain. We've already done a lot for low back pain and back pain in general, and we'll post the drills and everything that we've done thus far so people can catch up for that area. But we'll show some things now, just some simple things, a few exercises or a few drills for mobility for the cervical spine that everybody can at least try at home. And then if you need help beyond that, we'd be more than happy to give you advice and meet you online or meet you in person starting next week. All right. So I'm going to try to do most of this sitting down, and most of this is going to be from the upper back up. Again, if you go back to the previous video and materials, which we'll throw the posting up for, getting things mobile below the neck is really, really key to making sure that the neck is moving well. One of the things that we find, because we're very interested in making sure that there is symmetry up and down the spine as well as from side to side, is that if we're not moving through this part of the body, then that's going to put stress on that cervical spine and accelerate degeneration, accelerate the injury, the cumulative trauma for that neck. So you don't always have to go to the neck to fix neck pain, to improve it. You can go to other areas that aren't moving well. And unfortunately, most of us don't move well here. We're sitting behind a desk, or we're over technology, things like that. So just by getting more mobility through that spine, which is in those posts, I highly encourage you to start there, because that can help you with your neck pain considerably. So some really simple things to start with the neck. So I've assumed you've done this already, but follow along and try this yourself. I'm going to turn sideways because I'm going to start with a very simple exercise, a very simple drill. It's called the chicken. It's an anterior, so going forward to posterior glide. So starting with good posture, and again, never any pain while you're doing these drills. I'm just going to glide my neck from down low here forward. And if Pat can touch the back of my neck, if you can imagine a target area that you want to move, it's actually happening quite low. Don't think about your head moving. Your head moves with your neck. So I'm just going to glide my neck forward and then back. And when I'm coming back, I'm looking to get tall. So I'm going to glide forward and glide backwards. Now, most of us are really good at the forward, and we're not very good at the backward. And we think we're straight, but we're still very much cocked forward. So you might want to have somebody watch you and show you that when you're tall and straight with your ears over your shoulders, and then just do that several repetitions forward and back. So that's an anterior to posterior neck glide, or cervical spine gliding, okay? Same thing when we're doing other motions. We're going to want to aim for lowest vertebrae possible. We're going to do just some simple cervical rotations. So again, sitting up really tall, I'm going to use my hands just for a little bit of a cueing, and I'm going to try to rotate. We're going to do cervical rotations, first to the right and then to the left. Now, what most people will do is that they'll try to turn their head and then they'll crane their neck sideways, like they're looking down over their shoulder. But we want to stay very tall. So I'm going to, as I'm turning my head, I'm aiming actually to get my cheekbone over my collarbone the best that I can. Now, you may not get this far, and that's fine. Only go to that point where things tighten up. Don't go into pain. That is not a good thing, especially with the neck, and especially if it's hypermobile. The pain is your nervous system trying to tell you you're taking things too far, and it will tighten up those muscles. And so a gentle motion with very little tightness is much, much better than a big motion with pain, which will oftentimes lead to more symptoms. A little bit of stretch is just fine. All right. Next, we're going to do tilting. Again, same idea. We're going to start with really good tall posture, starting from the base of the neck here. And I'm going to try to bring my ear towards my shoulder, but instead of thinking about folding your neck over, I want you to think about reaching your ear over towards your shoulder. So it looks more like an arch motion, an arching motion, rather than a folding motion, right? And that shoulder should not come up. This isn't a shoulder to ear motion. This is an ear towards shoulder motion. And so going nice and slow, again, both directions. And using your hands sometimes to cue yourself is really, really helpful, okay? And then a final motion that we find extremely helpful to most people that have even some of this upper cervical instability is what's called an upper cervical figure 8. So we're going to be making a figure 8 in this plane here. So it looks like an infinity sign. So starting with very tall posture again, and having that head tall over the shoulders the best that you can. If you can imagine that your head is on a pivot, this is where this is coming from. It's not the whole neck making the motion, it's just the head making the motion, the upper cervical portion making this motion. And so using my nose, I'm going to start to draw that figure 8, sideways figure 8, as I go through this motion. Again, if you want to think about hitting some marks, some corners, you can imagine going around a corner, going around the other corner, and then back down. And then we can reverse this motion. Now, what we'll find is that, especially with this area, with as many people that have problems with their shoulder and neck, starting out with just some simple drills for the thoracic spine, doing things to wake that area up. So just some light touch rubbing or taking a towel and rubbing around the neck doing some light massage and such helps to get that area to move better, because this can be, especially if you've had pain for a long time, an area that is particularly difficult to feel these motions well. And then having somebody help you by watching you, or taking your own camera and setting it up so you can see yourself after you've done some of these drills, so you can tell that you're doing it well, can be extremely, extremely helpful there. But otherwise, we'd ask you to look back on the other videos, look for the spinal rotation drills, as well as the shin box motions, which are lying down, which we could show again if somebody needs that. But those are some really helpful things for people to start doing at home if you have cervical spine or neck pain or headaches as well, for that.
So I think we're just going to kind of summarize and sum up and say thank you, everybody, for participating. I'm just going to put back on my screen here for the contact information, and then we'll say bye to Pat and Dr. Higgins next week. We're going to be talking a little bit about shoulder, and perhaps we'll add in a little bit more of lumbar spine if that's still a need for everybody. Please email us. Mine is mheisey@centenoschultz.com. Then we have Dr. Higgins at neuroathleteclinic.com. We have the numbers for contact, as well as the website. So we're very easy to find online. You can search my name or Centeno Schultz Clinic. You can search Dr. Grove Higgins, or you can search neuroathlete.com. We really appreciate everybody participating, and we hope it was beneficial. Please email us and give us feedback along the way.
Fantastic. Thank you.
Thank you, everybody. See you next week.
Thank you to Teresa for joining us as well.